Many patients might have some other experience with cytotoxic or chemotherapy, and typically when we think of chemotherapy, there's a certain side effect profile. Patients treated, however, with immuno-oncology therapies or immune checkpoint inhibitors might develop different side effects. And basically how that happens is that the immuno-oncology treatments or the checkpoint inhibitors provide the ability of the immune system. It restores the immune system so that it can recognize tumors as foreign and then attack those tumors. So it doesn't act on the cancer cell itself. That's chemotherapy acts on the cancer itself. The immune therapies act on the patient's own immune system. However, when you restore the immune system, it's not really specific, so you also might have some inflammation of other healthy tissue, and that's the basis of the side effects. So inflammation of any tissue in the body or any organ system can occur. So for instance, if you have inflammation of the skin, you might develop a rash, might be kind of a patchy rash. If you have inflammation in the lungs, you might develop what we call a pneumonitis, or an inflammation that might feel like a respiratory infection. Could develop inflammation in the colon or in the intestines, so patients might develop diarrhea. So again, any organ system can be affected. Some of the organ systems, such as the liver or the kidneys, can become inflamed, and patients might not ever even understand or even have any symptoms that are associated with that. And healthcare providers identify that on blood work when a patient comes in at each visit. The important thing for patients is that they need to be rest assured that they need to contact their oncology treating team as soon as they develop any potential side effects, because oftentimes just a slight monitoring of either blood work, perhaps some hydration, or even a slight delay in the treatment of a few days can cause that inflammation of the healthy tissue to calm down and just relax so that we can then successfully go on to treatment.